Okay, let's get right into it. What we're talking about today is information that could genuinely save a life. We're going to break down exactly how to recognize the signs of a heart attack and what to do when every single second counts. The first thing we have to do is get that Hollywood movie image of a heart attack out of our heads. It's not always that sudden, dramatic, chest-clutching moment we see on screen. The truth is, the signs can be way more subtle, and they can even start showing up days or, believe it or not, weeks before the actual event. So, what's actually happening inside the body when someone has a heart attack? Well, think of it like a plumbing blockage. The blood supply that feeds the heart muscle gets cut off, usually by a clot. This starves a part of the heart of oxygen, and that muscle tissue, it begins to die. And that right there is why spotting the signs early is so absolutely critical. So what should we be looking for exactly? Let's dive into the warning signs of an active heart attack. And just as important, we'll talk about how to tell them apart from the signs of a heart that's weakening more slowly over time. Okay, this is the classic one, right? But it's so often misunderstood. Instead of a sharp, stabbing pain, most people actually describe it as a really intense pressure, a squeezing, or a feeling of fullness. The old saying is, it feels like an elephant is sitting on my chest. And what's really important to know here is that this feeling might last for a few minutes, or it could go away and then come right back. And here's something that trips a lot of people up. The pain doesn't just stay in the chest. A heart attack is famous for radiating out to other parts of the upper body. Most often it's the left arm, sure, but it can also pop up in the shoulders, the back, the neck, or even your jaw. Sometimes you might only feel the pain in these other spots with no chest discomfort at all. Feeling like you can't catch your breath for no good reason? That is a huge red flag. This can happen with or without that chest pain we just talked about. So if you're suddenly struggling for air while doing something simple, something you normally handle just fine, your body is screaming a warning at you. You gotta listen. Now, beyond those big three, there's a whole cluster of other signs to be aware of, like breaking out in a cold, clammy sweat out of nowhere, or feeling nauseous, maybe even having stomach pain. A lot of people mistake that for indigestion, and it's especially common in women. Then there's that sudden feeling of being dizzy or lightheaded. And this last one is subtle but so important. A deep, unexplained fatigue that can show up days beforehand. Here's the key takeaway. If you or someone else is experiencing two or more of these things together, you cannot ignore it. Now, it's really important to draw a line between an acute heart attack and the signs of what doctors call heart failure or a weak heart. A heart attack is sudden. It's an immediate blockage. It's an emergency right now. A weak heart, on the other hand, is a chronic condition that develops slowly over time as the heart's pumping power just gradually gets worse. And the symptoms look very different. So what does this more chronic condition look like? Well, you might start noticing your feet or ankles are swollen. That's because the heart isn't pumping strong enough, so fluid starts to back up. You could feel just wiped out after simple things, or have this nagging cough that gets way worse when you lie down. A rapid or irregular heartbeat is also common, as the heart kind of struggles to keep up. If you see these signs developing over a few days, that's your cue to get medical help. All right, we've arrived at what might be the most important part of this whole explainer, your action plan. Knowing the signs is step one, for sure. But knowing what to do in those first critical moments, that's what truly saves lives. So put yourself in that situation. You're seeing the signs either in yourself or in someone near you. That pressure, the shortness of breath, what is the very next thing you do? Here it is, your playbook. Step one, without hesitation, is to call your local emergency number immediately. Don't even think about driving to the hospital. While you wait for help, have the person sit down and try to stay as calm as possible to reduce the strain on their heart. Loosen any tight clothing. Step three, if they're conscious and not allergic, have them chew one regular aspirin. Chewing it helps it get into their system way faster. Step four is nitroglycerin, but listen, only if it's been prescribed to that specific person. Never ever give someone else's medication. And finally, if the person becomes unresponsive and stops breathing, you start CPR. Right away. Push hard and fast in the center of the chest. We've covered the emergency. Now let's totally shift gears and talk about how to avoid getting there in the first place. Because we can all take proactive steps to build a healthier, stronger heart for the long haul. What does this number mean? 100,000. That's about how many times your heart beats every single day. Think about that. 100,000 beats. It is by far the hardest working muscle in your body, and that alone really shows why it deserves our care and attention. So, how do we take care of it? Well, the good news is the steps are pretty straightforward, but they are so powerful. It starts with just moving. Aim for about 30 minutes of exercise most days. Then think about what you're eating. Cut back on those fried and oily foods. It's also absolutely essential to know your numbers and keep your blood pressure and blood sugar under control. If you smoke, quitting is the single greatest thing you can do for your heart. And finally, find ways to manage your stress and make sure you see your doctor for regular checkups to stay on top of everything. We've gone over a lot, from symptoms to emergency actions to prevention, but if there is one single idea I really want you to walk away with today, it's this. The most crucial point is this. Time is muscle. From the moment a heart attack starts, the clock is ticking. The longer that heart is starved of blood, the more that muscle tissue dies. So faster action doesn't just increase the chance of survival, it dramatically reduces the amount of permanent damage. It preserves quality of life for years to come. Knowing these signs and these steps, it changes you from just a bystander into a potential lifesaver. It gives you the power to act when someone's life is on the line. So after everything we've talked about, the final question is really for you. Are you prepared to be the difference for a family member, a friend, or maybe even a complete stranger?